Every mother's record that has a delivery occur in the hospital must include a code from W2C4 to W2C9, which would indicate like a single live born, if there's twins, if there was a stillbirth. And these codes would be sequenced as a secondary diagnosis and never a principal diagnosis. These are only coded on mom's records, never a newborn. They're not coded on subsequent visits, so only on that delivery. And these codes are not used on deliveries outside of the hospital. So with that said, if a delivery occurred outside the hospital, these codes, of course, would not be coded since the baby was not delivered in the hospital. This would include the patient, a patient that delivered a baby in the parking lot of a hospital, but not actually inside the hospital. So when the mother delivers outside the hospital prior to admission and is admitted for routine care with no complication, the coder is going to code the W2C4 as the principal diagnosis. Now, if there were complications, they were admitted after they delivered the baby outside of the hospital, now admitted to the hospital with complications, those complications are going to be the ones that are coded as the principal diagnosis. So just in ICD-10, category Z37 is classified for the outcome of delivery. So selection of principal diagnosis. In episodes when no delivery occurs on admission, the principal diagnosis would be the complication that necessitated that encounter. If more than one complication exists, either code may be listed first or principal. When a delivery occurs, the principal diagnosis must correspond with the main circumstance or the complication of that delivery. In cases of cesarean deliveries or C-sections, the selection of the principal diagnosis should be the condition established after study that was responsible for the patient's admission. Now, if the patient was admitted with a condition that resulted in performance of a C-section, that condition should be selected as a principal diagnosis. So an example, if a patient was admitted for a scheduled C-section due to a previous C-section, the code for that previous C-section delivery would be principal. Now, if the reason for admission is unrelated to the condition that resulted in the C-section, the condition related to the reason for the admission would be selected as a principal even if a C-section was performed. So an example of this would be a patient was admitted due to post-dates. So they're going to be induced. After 10 hours of labor, the baby's heart rate starts going down. They have decreased decelerations, and the patient ends up with a C-section. The post-dates would be the principal, although the reason for the C-section was actually due to the baby's decreased decelerations. A normal delivery. 650 is only used for normal delivery as a principal diagnosis. So if any complications exist, another code from Chapter 11 should be assigned, not 650. So what is a normal delivery? It's a full term. They deliver a single healthy infant with no complications. Now, additional codes from other chapters may be used if they are not related to and are complicating the pregnancy at all. The patient had a complication at some point during their pregnancy, but at the time of admission for delivery, that complication no longer exists. 650 may still be used. So the normal delivery code in ICD-10 is 080. So fetal conditions affecting the management of the mother is classified in 655 to 656. These are only assigned when the fetal is actually responsible for modifying the management of the mother. Now in ICD-10, there's a seventh character to specify the fetus that is affected. So example, if the physician documents that an obstructed labor is due to a breech presentation of a twin pregnancy and fetus 2 is affected, the seventh character would be 064.1 and then our XX2 for the breech presentation of that second baby.